medicalstudentmissions.org, learning through service. In January 2010, the eyes of the world turned toward Haiti. Media empires from around the globe sent teams of newscasters to record the devastation. In the immediate aftermath, 250,000 were dead and thousands more wounded by the quake. Port-au-Prince was left with 1 million inner-city refugees scattering to the regions of the mountain poor. Since August 2010, Medical Student Missions has sent 26 teams of medical professionals to some of the poorest regions of Haiti. After landing in Port-au-Prince, these teams wind their way by jeep to the mountain regions to serve the neediest of the needy. It takes the team several hours to reach our destinations. On these trips, we operate mobile clinics that are designed to be set up quickly. Each spot has been designated by local health authorities. With little or no advertisement, they start coming and they keep coming. We might set up in a soccer field one day, the next day under the canopy next to the market, in a Catholic church, a school, or even a building with only a tarp for a roof. We bring our own formulary of medicine. Clinic starts the minute we set up and ends when the last patient has been served. Where we stay in Haiti, a man named Tifa owns the place, and it's almost undescribable, the scenery. Our accommodations are fairly modest. It's a concrete building, tin roofs, which is really beautiful sounding during the rain. But just right behind us, just right over the edge of the valley, is this beautiful waterfall. And all night long, you hear it when you're laying in the bed. You can hear the water cascading over the waterfall.
What's been exciting about this is a chance to give people interested in doing volunteer medical work in Haiti a chance to work alongside physicians, Haitian physicians, Americans, other nationalities, to provide medical care in a rural setting using our clinic mobile technique of pairing a medical student with a nurse and having physician backup. We give an opportunity to actually take care of people with a wide variety of diseases, from horrible skin conditions to malaria, cholera, typhoid, meningitis. We had a chance to see it all.
It's day number 2 and we're setting up in this little shack, which I heard is actually an upgrade from last year because we have a roof today.
So yesterday we were treating a small child with an abscess that he had for quite a long time. It got really big.
The story was that he had fell backwards a couple of days before, 5 or 6 days before, and in that time there was this bump that came up on his head, and it was kind of tender, kind of painful, and he was the kid was, kind of acting like it bothered him. And so on exam, what we found was something about this big, probably about the size of a Kennedy half dollar, probably about a quarter's width, poking out, and it was fluctuant. And what we mean by that is if you press on it, it's not hard. You can feel there's sort of a soft fluid inside, and that's an abscess. And so what we have to do for an abscess is to drain it, because antibiotics alone don't work.
I think it was really neat that a lot of diseases that we learned the first 2 years, we were able to quickly kind of apply it and be able to recognize the patterns of like heart failure, such as like JVP and edema, and that was cool. And then we saw a lady with hyperthyroidism, and just how all these clinical features just all was finally put together. You don't really get to see that the first 2 years, at least our meant to be thought.
So the main reason why I came on this trip is first 2 years of medical school. With the preclinical, you're studying in the library, and it's really easy to get bogged down in like the textbook details and kind of lose perspective of what's going on out there in the world and what you're really here to do. And I think being here in Haiti really helped me bring back the sort of problems that's out there in the world, and really what we should be caring about, like more than grades or being in the top of the class. It's really about your passion to help people.
The most exciting thing that I saw while I was here on this trip was the students going through their aha moments. I think as an educator, that aha moment, that time when you can take the book word, the words you see in Bates, or the things you read about, the sounds of cardiac exams, or the description of a limb or a joint, and actually take those words and relate it to a patient where suddenly they hear atrial fibrillation, or the murmur of mitral stenosis, or aortic regurg. We saw all of that while they were here. And I think those aha moments are what make an educator, or what makes it all worthwhile for the educator. And these guys had 5 solid days of aha moments while they were here.
It was a little over my head, but I appreciated it. And it was just really interesting to see this level of disease, because it's rare to see that in the United States.
Seeing things here that I don't suspect I'd see anywhere else in this hemisphere. Saw a young child from the mountain community, came down with a very large goiter and other signs of protein malnutrition, and going through the differential diagnosis with the students, it became clear that she had iodine deficiency, and the simple intervention was to go and find some iodized salt. In fact, the instructions were to buy all the iodized salt they had in the store and send it back to the mountains with the girl's mother. And all the iodized salt that they had was one container, which we purchased and sent her with.
But I remember just one day I was asked to try and help people as they came in the door to get to the nurse, get to the doctor, or get to the pharmacy inside this abandoned church. And so I did that. Hand movements usually work. And as I was standing in line with this one woman, the pharmacy kind of signaled there was no more medication. We completely ran out. We used up everything, even the vitamins. And I had to have the translator tell the mother, we have no more medicine. And that's not a good feeling. I'm a pretty self-sufficient guy. I see what the problem is and pull the resources together and then take care of it. But there was no taking care of this. No one did anything wrong. It's just there's no way you can plan on how many people are going to come. And they just kept coming that day, and we had to turn people away. And, I didn't know how to tell the mom that. So I had the translator tell her that, there was nothing else we could do. I got pretty choked up about it, and went outside, where a door would have been, and kind of leaned up against the wall and cried. And that's when I realized, here I am feeling all insufficient. And that's what these people live with every day. And most of them are very happy and so appreciative of anything that we do. So if you're like me and you think you probably don't have any skills to add, you're wrong. There's always something you can do in Haiti. Please give us a try. It'll change your life.